there's a new technology right here in Chicago. Jody Bethke is from Lincoln Park Med Spa to talk to us a little bit about it. Good to see you, Jody.
Good morning. How are you?
Now, the laser hair removal has been around for a while, but you guys have something new that you're using that helps people with darker skin or people who have tans. And we have a model here that's been getting this. But let's start off with what exactly is laser hair removal?
Laser hair removal is, well, it's done with a laser, and this is the Cool Glide laser from Cutera. And the benefit of this laser is it actually has a cool tip. And so what laser hair removal does is the laser targets the melanin in your hair follicle. So there has to be pigment, number one, in order for laser hair removal to work. So we can't do, gray hair or blonde hair, but as long as there's pigment in the hair follicle, we can treat everybody. Now, historically, lasers only worked with lighter skin and darker hair like Sarah, but now we can do all skin types, all hair characteristics, minus the blonde and the strawberry blonde hair, but all skin types, and you can even be tan and do laser. So throughout summer, it's not too late to do laser hair removal.
So one of the questions a lot of people, of course, would have is it lasting? Will it last forever? And does it hurt? Because when you say laser skin,
Right. It does last. At each session, the laser permanently destroys the follicle when it's in its active stage. And those follicles are not going to come back. They're permanently gone. Now, your body can create more follicles during pregnancy or menopause, but for the most part, it is a permanent treatment.
It's a done deal once you do it.
It's a done deal. It is absolutely a done deal. And about 6 treatments, and you come every 4 to 6 weeks.
So and we talked about not only for women, we've got Sarah here, she's been getting treatments on her legs, but you can do back hair, which a lot of guys want to get rid of, and waxing that can be extremely painful.
Exactly, and all of my clients tell me that this is less painful than waxing.
Okay.
And we can do male, female, all body parts, it doesn't matter.
I want to show you a couple of pictures that we have. We have a picture of a man who has a beard and razor bumps, and this is a common problem that people with dark skin, particularly African-American men, have. And then let's show the after picture. Look at that. That is amazing.
Yeah, it is amazing. This is pseudofolliculitis, and what it is an inflammation of the hair follicle. Very, very common with curly hair. It gets stuck underneath the skin and causes a little inflammation. So with laser hair removal, we go right to the source.
Okay.
Removing the follicle is going to clear it right up.
Let's show on Sarah what we're doing. You said Sarah's had a couple of treatments. Her legs look bare. I don't see any hair on them. Oh, we got to put these glasses on, right?
Yes, we do. We're going to go ahead and put on our glasses to protect our eyes.
Now, how long is the treatment?
Depending on the area, underarm takes about 10 minutes, bikini underarm about 30, legs about an hour. So it really goes relatively fast, compared to electrolysis.
Sure.
But she's had a couple treatments, but as you can see, she still has some follicles underneath the skin. We're going to try and pull those out.
Okay.
So what we do is she comes in shaved with nothing on the skin, very bare.
Now, if you want this, you have to let your hair grow out at least 3 weeks, right? 3 to 4 weeks.
You just don't want to wax beforehand, 3 weeks beforehand. But you can. The wonderful thing about laser hair removal is you don't have to go through that awkward stage like waxing. You can shave in between your treatments. Okay. So we're going to go ahead and do this treatment here. This is the laser. This is actually a cold tip. So the other benefit is it continuously cools the epidermis, so it takes away any chance for side effects. Okay. So we're going to go ahead and place this on the skin. We're cooling the skin as I do this. Cool it, and then I'm going to move the laser, and we're going to go ahead and pulse.
Now, is this good for every skin type? Not meaning as far as the color, but the sensitivity, because there are people out there who, they put anything on their skin and they break out.
I have not seen any problems whatsoever. We've been doing 10 treatments a day for 3 years, and it's very, very safe, all skin types, and just wonderful results.
Well, we want you to quickly test me out here, Jody. Now, you're putting it on the low setting, because I've never done this before, and I honestly didn't want my hair removed from my arms.
It's honest. It is an appropriate setting for your skin type.
Okay.
You okay?
I don't feel anything.
See, it's really relatively painless.
So this, you have it on the low setting. Is this really working?
This is appropriate, actually.
Really?
This would be appropriate for your skin type.
I don't feel anything.
For the most part, you just feel cold. I'm continuously icing the skin, so it takes away.
It feels like a piece of ice being rubbed across my skin. Wow.
And with each treatment, you're going to see a gradual reduction in your follicle count. So most people are at about 60% reduction by the 3rd treatment. So it's really not too late to get this done for summer, and you can go into the summer months and get a tan. Use your sunscreen.